Hello and welcome to Healthy Life. We will be discussing how to treat constipation in this video. Constipation is one of the most prevalent digestive problems, concerns that affect more than 2.5 billion people around the world. Every year, millions of people in the United States alone. Constipation is commonly misunderstood. Not getting enough bowel movements on a regular basis in. Constipation is a more complicated and difficult condition to deal with in reality. More subtle than that, with a variety of symptoms you would not recognize. In this video, we'll go through the most prevalent causes of constipation and how to avoid them. The 3 easy measures you may take to avoid and constipation should be treated. We'll also talk about how to live a healthy lifestyle. Changes that aid in constipation relief. People believe they can't be constipated if they have a bowel movement every day, says one expert. The medical definition of constipation necessitates, even if a person only has one of these symptoms, less than 3 bowel movements per week, for example. Straining to begin or finish a bowel movement. Stool texture that resembles rocks and pebbles. Alternatively, a feeling of emptiness that isn't quite right. Constipation can occur for a variety of reasons, including when stools travel through the colon too quickly. They're moving at a slower pace than they should be. The slower the food, the better. The more water that passes through the digestive tract, the better. The more the colon absorbs, the tougher the feces become. Constipation can affect someone who poos less than 3 times per week. Constipation can be caused by a variety of factors. These can include the following: dietary changes, such as a low fiber consumption or a lack of hydration intake. Consuming pork or chicken undergoing colon surgery. If you have diabetes and a history of gastrointestinal problems. Irritable bowel syndrome, for example, or a history of pelvic floor issues. Obstacles in the intestines and pregnancy. It can also be caused by taking certain drugs. Antacids containing aluminum and calcium, for example. Diuretics, anticonvulsants, calcium channel blockers. Iron supplements, opioid pain relievers, and Parkinson's disease meds. Disease. Physical inactivity is another prevalent cause of constipation. Constipation can also be caused by a lack of physical activity. Physically fit persons, such as marathon runners, have been found to be happier in previous research. Constipation is less common in you than it is in others, although the precise causes behind this are unknown. A 2013 study found that increasing physical activity in the form of regular workouts, exercise assists older adults in improving constipation. People WHO spend days or weeks in bed or sitting in a chair due to some inconvenience. Constipation is more likely in medical conditions, with dehydration being one of the most common reasons. Constipation has been a problem for me for a long time. The food you eat has an effect on you. From the stomach to the large intestine, often known as the colon. In the event that you do not have enough water, the large intestine soaks in your body already. Drain water from your food waste, which leaves you with difficult stools to pass. The colon's motility can become sluggish at times. Constipation occurs for no apparent reason. As a result, the most prevalent cause of constipation is a lack of fiber in the diet. People that have a high IQ. Those who consume dietary fiber have a lower risk of developing diabetes. Constipation. This leads us to the first point concerning: what is the best way to avoid and treat constipation? Modifications. The most critical step is to change your diet. To relieve constipation, use the following steps. It is more significant than any other factor. You can take medicine because medicines can only help with a short-term episode of the problem. Constipation. In the vast majority of situations, the true cause of constipation is as a result of poor dietary decisions such as low intake, excessive consumption of junk food and foods high in fat and sugar, lack of fiber. So, the first and most important nutritional change you should make is to eat more fruits and vegetables. Add fiber to your diet. This is due to fiber's ability to improve health. Bowel movements that are frequent, especially when a person is. It is combined with enough hydration. Dietary fiber makes you gain weight and size. It softens the hardness of your stool. It's easier to pass a thick stool. Reducing the likelihood of constipation. The average adult in the United States consumes roughly 15 grams of sugar each day. We just need a few grams of fiber per day, far less than we require. According The American Dietetic Association is a group of people who work in the field of nutrition. Women under the age of 51 should aim for 25 grams of protein each day. Men under the age of 51 should aim for 38 grams of fiber each day. Gram of fiber each day. Fruits and vegetables are high in fiber. Entire grains and vegetables. Legumes such as lentils, chickpeas, and various nuts. The following foods are low in fiber. Cheese, meat, and eggs are all heavy in fat. Items that have been heavily processed, such as white bread. Fast food, chips, and other ready-to-eat meals. Drinking enough of water is the next nutritional modification we'll focus on. Water and other liquids, such as naturally sweetened fruit and vegetable juices, should be consumed. To help the fiber operate better, drink juices and clear soups. Your stools should become softer and easier to pass as a result of this modification. Pass. When your body is properly hydrated, water is removed from the colon in smaller amounts. Your feces will be soft and easy to pass as a result of this. Probiotics should be included in your diet. As some of you may know, our stomach contains beneficial bacteria. Bacteria are common in our bodies and play an important role in our health. Are extremely crucial for proper meal digestion. Probiotics are bacteria and yeasts that are alive, that are beneficial to the digestive system. Probiotic bacteria include a wide range of bacteria. They all have various advantages, but the majority of them are beneficial. Lactobacillus and bifidobacterium are two types of bacteria. Probiotics play the most essential role in the treatment of antibiotic-induced diarrhea. Antibiotics are more effective when taken for a longer period of time. Damage to the healthy bacteria in our gut, resulting in malabsorption and, eventually, diarrhea. Is it true that probiotics can help you get rid of constipation? Researchers from King's College in London conducted a study in which they divided participants into two groups. People with constipation were divided into two groups. One group of people. The first group received probiotics for 2 weeks, while the second group did not. Probiotics raised the number of weekly bowel motions by and, according to the researchers, it softened the feces and made them easier to pass. Bifidobacterium containing probiotics? The most effective looked to be the results of the study were reported in the American Journal of Clinical Nutrition. Nutrition. I've included some links to some of the best probiotics on the market, so make sure to read the description box down below to learn more about them. Let's have a look at some meals to avoid if you want to avoid constipation. 1. Alcohol. Constipation is usually linked to alcohol consumption. This is because drinking a lot of alcohol might cause you to lose a lot of fluids. Dehydration is caused by the loss of water through your urine. Poor hydration, either as a result of not drinking enough water or as a result of excessive sweating. Constipation is frequently linked to the loss of too much of it through urine. 2. Foods containing gluten. Gluten is a protein present in cereals such as wheat, rye, and barley. Rye and barley. When eating meals that contain fiber, some people may get constipation. Gluten. Gluten intolerance affects some people. Gluten intolerance, often known as celiac disease, is a condition that affects many people. 3. Dairy products and milk. Dairy appears to be another common source of, at least for some people, constipation is a problem. Infants, toddlers, and children appear to be especially vulnerable, possibly as a result of a sensitivity to the proteins contained in. There have also been accounts of comparable events in people who have consumed cow's milk. 5. Consciousness. Red meat. Red meat has a lot of fiber, which might make constipation worse. Reasons. To begin with, it is low in fiber, which adds to its nutritional value. It adds weight to stools and aids in their movement. Furthermore, compared to other varieties of meat, such as chicken and fish, red meat has a higher fat content. Fat content, therefore high-fat foods take longer to digest. For the body to digest this may, in some situations, increase the risk. Constipation risks are increased much more. Fried foods are another sort of food you should avoid if you have constipation. Or processed carbohydrates and quick foods. So, now that we've covered diet-related changes for curing constipation, let's move on to the next step. Discuss some lifestyle changes you should make that will assist you in managing constipation. 1. Exercise on a regular basis. Exercise does more than tone your heart and other muscles, according to researchers. Exercise is necessary for bowel movements to be regular. In In truth, constipation is caused by a number of factors. Idleness. The recommended amount of moderate exercise each day is 30 minutes. No. 2. Stress reduction. Many disorders can be exacerbated by stress. One of them is constipation. Try deep breathing, meditation, relaxing, and retiring to bed sooner. Breathing exercises might help you control your stress. Bowel retraining. No. 3. People who suffer from persistent constipation benefit from bowel retraining. It entails attempting to use the restroom at the same time every day in an effort to assist in the training of your body to have regular intestine motions. You should aim to have a bowel movement at least once a day. Movement. After a few weeks, you should have a good concept of what you want to do. Every day, I have a bowel movement at the same time. Make a conscious effort to have a bowel movement on a daily basis. The best is, in general, the best. After eating, wait 20 to 40 minutes. The majority of doctors. It's best to go early in the morning, perhaps 20 minutes after breakfast. To test if you can have a bowel movement, spend 10 to 15 minutes on the toilet. Make certain you do not exercise strain as you try to move. If you don't pass a stool, go back to your normal routine. Keep in mind that it can take a long time. It's time to train your bowels, so don't stress about it. Initially, I was unable to have a bowel movement. Other simple lifestyle changes that have been shown to help reduce constipation involve eating your meals at the same time every day. Every day after you've finished, have a glass of water. Get up. Getting some modest activity, such as walking, is a good idea. Following breakfast and supper during your lunch break, go for a 20-minute walk. Break. As a snack, bring a piece of fruit with you. White bread can be replaced with whole wheat bread, and white rice can be replaced with brown rice. Make sure you get enough rest. When you feel the need to go to the bathroom, use the restroom right away if you're in a hurry. Don't try to hold it. Now that we've covered the nutrition and lifestyle modifications you should make, let's move on to the next topic. Constipation medicine is a type of drug that is used to treat constipation. Constipation is treated with laxatives, which are first-line medications. There are many various forms of laxatives available now, each with its own mechanism of action. Laxatives, on the other hand, are a type of laxative medicine used to help an individual empty their bowels. Laxatives come in liquids, tablets, and capsules that can be taken orally, by mouth. They can also be injected into the rectum, for instance. Enemas or suppositories. Laxatives, like any other drug, can cause constipation. Can have negative consequences, which we'll cover later. Laxatives are classified into several categories based on their mechanisms of action. Laxatives in general can be classified into 4 categories. Bulk-forming laxatives, commonly known as fiber supplements, are the first. These are examples of work in the same way that dietary fiber usually does. Fiber increases the water content and weight of the food. Feces, which aids in its rapid passage through the colon. When taking fiber supplements, make sure to drink enough of water. It is critical to consume adequate amounts of water. It normally takes 12 to 24 hours. It will take several hours for the changes to take effect. Adults suffering from constipation should begin taking. First, bulk-forming laxatives. Osmotic laxatives are the next type of laxative. The name osmotic comes from the Greek word osmosis, which means to swell. Osmosis is derived from the Greek term osmosis, which means movement. A body of water, small particles, such as proteins, fibers, or carbohydrates, are used as osmotic laxatives. Encourage a net flow of water into the heart of the city. Osmosis is a process that allows water to pass through the intestines and into the body. The outcome of utilizing osmotic laxatives in the digestive system. The purpose of the intestine is to draw water into the colon center, resulting in. Next, we have stimulant laxatives, which are softer and easier to pass. As a result, they are stimulants, as their name suggests. Laxatives with stimulants cause the intestines to contract and push the stool out, and this is related to their mode of action. They take action. Are fast-acting laxatives that cause bowel motions by stimulating the contraction of the intestines, muscles in the intestines, and they work well when they're used. Emollient laxatives, also known as stool softeners, are the last type of laxative. Softeners for stools. By assisting the water in our bodies, we can boost bowel movements. Colon to readily blend into the stool, preventing dryness. And piles of firm stool. These laxatives help to relieve straining during passage. The number of stools they are, however, the least effective alternative. For the treatment of constipation, they're ideal for folks who have constipation can be either brief or mild and chronic. In the description, I've given links to some of the greatest laxatives accessible online. Please see the box below for more information. Bulk-forming laxatives should be used initially to begin treatment because they are the safest. It's also extremely effective. Psyllium husk is an excellent bulk food. Laxative. Psyllium is a type of fiber derived from the husks of cereal grains. The seeds of the Plantago ovata plant Eisvogel is another name for it. Maintaining regular bowel motions and managing a chronic illness. Psyllium has the power to soften your skin. If you drink enough water, you should be able to pass stool. Methylcellulose is another example of a bulk laxative. Cellulose carboxymethyl, cellulose carboxymethyl, cellulose carboxymethyl, cellulose carboxymethyl. Patients who do not respond to bulk laxatives alone may benefit from the inclusion of additional laxatives. Is frequently the next step in constipation treatment. Then there's a laxative that's recommended next. Osmotic laxatives are the most common. The most common osmotic agents are lactulose and polyethylene glycol, PEG. Laxatives are popular because they are both effective and safe. For adults, 15 to 30 milliliters of lactulose should be taken once or twice daily. Lactulose. Laxative-containing products usually start acting after 1 day. Luz is a decent brand that contains lactulose, as well as Mira LAX and Laxolite. Polyethylene glycol-containing products. If the patient's constipation persists, the next step is to add a laxative. A laxative stimulant intestinal motility is increased with stimulant laxatives. As well as intestinal secretion, they begin their work in a few hours. Bisacodyl is an over-the-counter stimulant laxative that is effective and safe. Dulcolax is a brand name for a product. Bisacodyl is a valuable substance. A laxative that is particularly well suited to single-dose administration in patients with constipation that is only transient. Sodium is an example of a stimulating laxative. Creamifin and Creamalax are two brands of picosulfate that are readily accessible. It's extremely interesting. Although effective, it has the potential to produce diarrhea and loose stools. If you still experience constipation or have severe persistent constipation, interventions may be necessary. The use of enemas and suppositories is common. Enemas are fluid injections into the rectal cavity to encourage or cleanse the discharge of your bowels. Suppositories are solid drugs administered through the rectum into the body. Suppositories contain one or more types of laxatives, most commonly stimulant laxatives such as bisacodyl and stool softeners. Sodium docusate, for example, is a softener. Lubiprostone is a new medicine that has recently been approved to treat constipation. Lubiprostone increases water secretion in the intestine, which softens the stools and also boosts the immune system. The rate at which food passes through our intestines. Lubelax and Lubowel are two brand names for it. It's true. 8 to 24 grams twice daily is the recommended dose. So, perhaps, friends, with this video, I was able to help you. To provide you with some information on constipation and its causes. Treatment. If you found this video useful, please consider becoming a member. Subscribe to our YouTube channel. You can also forward this video to someone who might benefit from it. Thank you for viewing, and I hope to see you again in the next video.